Next, we have our last and final item before us, item number 2015-112, California's School District Mental Health Funds and Services. Senator Bell. Welcome, Senator Bell. After Senator Bell give his opening testimony, we will move to the auditor, after which the affected agency is invited to please come up to the table and take a seat, and then we will move from there. Welcome, Senator Bell.
Mr. Chairman and members, good morning. Today I'm presenting an audit related to mental health services in schools. If approved, this audit will examine 4 special education local plans, or SELPAs, which is what we refer to them as. The audit will evaluate SELPA's use of mental health funds, student performance outcomes, and whether they're providing mental health services to students as required by law. AB 3632, which was in place since the 1980s, mandated county mental health agencies to provide mental health services to students. But we changed that in 2011 with the Budget Act and AB 114, which is a budget bill, eliminated this mandate and shifted the responsibilities to school districts to provide mental health service. I'd like to point out that this was an example of a major policy decision being made in the budget trailer bill process, which resulted in inadequate policy discussion. There was no policy discussion of this, so we shifted the mental health programs for kids to the Department of Education without any policy discussion to any great extent. Many families have expressed their concern to me about their children struggling to receive the necessary services that they need. It's unclear how the SELPAs are using the funds and what services are being provided. There has been a limited statewide tracking of the data since the budget implementation 5 years ago. This is an important audit that will provide transparency and accountability to ensure mental health services are being provided to the needed emotionally disturbed children in California. I'd like to turn it over to our experts, and thank you very much.
Thank you very much. We have our State Auditor, Ms. Howe. Would you please move forward? Thank you.
Certainly. Thank you, Mr. Chair. As Senator Bell indicated, this is an audit of mental health services provided to students and looking at a 5-year window. The reason the Senator has asked us to look at a 5-year window is to look at services provided under the prior structure under AB 3632 and then now under AB 114. So the first objective we would start out with is looking at the state level, what the State Department of Education is doing, what their responsibilities are with respect to oversight and administration of special education law, both federal and state law, and whether or not the state is complying with those relevant laws, such as monitoring funding, monitoring outcomes for students. In addition to that, Senator Bell and other members requesting the audit have asked us to evaluate the impact on the number of students placed actually in residential programs, both in the state of California and out of the state of California, and again, prior to the enactment of AB 114 and subsequent to the enactment of that legislation. In addition, he's asking us, as he indicated in his opening comments, to look at SELPAs. He's asked us to look at 4 SELPAs and look at a variety of things with respect to those SELPAs. One issue of concern is the complaint process. First, are parents and guardians being educated about, and are they aware that there is a complaint process that they can exercise if they have concerns about services being provided to their students? So he has asked, he and other members requesting the audit have asked us to assess that process, determine whether or not it's effective, but certainly look to determine whether or not parents and guardians, again, are aware of that process. Also, with respect to SELPAs, looking at that 5-year window, try to provide information with respect to students and specific issues. The number of students that SELPAs were serving prior to the enactment of AB 114. So under AB 3632, how many students were being served, and has that changed subsequent to the enactment of AB 114? Also, with respect to that same time frame, the before and after, looking at the type and frequency of services that are being provided, who those providers are, have the providers changed, have the providers reduced the number of services that they are providing to students, and try to determine some of the reasons for that. In addition, looking for changes in treatment, determine whether changes in treatment have occurred by the service providers as a result of this transition. An important issue is, again, I think at the state level, has the state put a mechanism in place to monitor the change in services, perhaps the change in services from when this was under AB 3632 and now under AB 114. Also, Senator Bell and others have asked us to look at the funding sources, both the state and federal funding sources for mental health services, again over that 5-year window, and not only looking at SELPAs but looking at some LEAs, the school district level, comparing their budgets to their actual costs, and determine whether or not, if their costs are exceeding their budgets, what other funding sources are they using to provide services to students. Then using the SELPAs that we had identified, and again, the members have asked us to look at 4 SELPAs, also look at some LEAs, because these services are now required to be provided by the school districts. So looking at each of those LEAs that we select, what was their process for hiring either service providers or individuals to provide mental health services to students, looking at qualifications, looking at comparing contract providers versus other individuals that the LEAs have decided to hire, and then looking at the process that the LEAs use to actually assess students and determine whether or not a student needs an assessment, and if that is denied, whether or not there's a process for parents to, again, file a complaint and have the opportunity to have their particular student or child assessed. And then at the LEA level, again, how are they measuring and tracking students and the outcomes for those students? And then finally, to the extent we can, compare the number of students with diagnosed mental health issues in California to the number of students who are actually receiving services. Again, I think some of that information hopefully will be available at the Department of Education. Some of the background materials I looked at in preparation for the hearing today, there's some work that the Department of Education has done as far as surveying the SELPAs prior to the enactment of AB 114 to really have a baseline understanding. So I think there will be some fair amount of work we can do at the Department of Ed before we go out in the field and visit the 4 SELPAs and then the LEAs as well. The budget for this audit is relatively large. It's 4,800 hours. That's a big audit for us. And the reason for that is the time frame. We're looking at 5 years. We're looking at requirements under AB 3632, determine whether any of those have changed now under AB 114, and then also going out and visiting SELPAs as well as visiting school districts, and then conducting a fair amount of work at the Department of Education. My intent on this audit, in the event the committee approves it, is to throw some resources at it. Actually, we believe this, because there are multiple locations for us to conduct audit work, we would be able to put at least 2 teams on this audit, perhaps 3, depends on whether or not that would be efficient, but I think certainly we would put 2 teams of auditors on this particular audit to try to get the work done as quickly as we can, even though it's a large audit. So with that, I'm certainly open to answer any questions.
Thank you very much. We'll have the agency, the affected agency, please come forward.
Go ahead.
We'll have the affected agency to please give their testimony, after which we have some witnesses that Senator Bell has brought who will also give your opening comments as well.
Thank you.
Please proceed.
Thank you, Mr. Chair. Debbie Look on behalf of State Superintendent of Public Instruction Tom Torlakson. We'd just like to convey that the California Department of Education has no objection to this audit. We have been pleased to work with Senator Bell and his staff in preparation for his audit request, and provided him with any available information that he requested that we do have available. We do clarify that the department did not track data under the 3632 scenario, as those services were offered by county mental health agencies. And I have with me Chris Druin from our Associate Director with our Special Education Division to answer any questions the members might have.
Thank you very much. Any others? Great. Would you like to have a few comments? State your name for the record.
Carol Schroeder with the California Alliance of Child and Family Services. Our member agencies have provided educationally related mental health services both under AB 3632 and under AB 114. And they also care for, in foster care, some children who receive AB 114 services now. So it's sort of have an interesting perspective. I'd like to thank Senator Bell for bringing this forward. Nobody ever likes to be audited, but I think it's a reasonable request, especially with this, as he indicated, this massive shift in policy that occurred in 2011. And just by way of a little bit of history, back in the mid-1980s, a lawsuit was filed on behalf of a student who is called Christopher T. He was in the San Francisco Unified School District, and his parents had alleged that the school district had not provided him with in his particular case, the mental health services, which included residential treatment, for him to be able to succeed in school. Ultimately, when that lawsuit reached its conclusion, then Speaker Willie Brown put together what became known as AB 3632, and basically what he said was, well, let's see, who knows about mental health? Well, mental health departments. Who knows about education? Well, the schools do. Who knows about residential treatment? Well, social services does. So let's put it together in such a way that the folks who know about education take care of education, the folks who know about mental health take care of that, the folks who know about residential treatment take care of that, and the state will fund this. We retained that system from the late 1980s until 2011, and as Senator Bell indicated, the change in that didn't have anything to do with whether or not AB 3632 worked well or not. It had to do with budget decisions that said we're going to shift this over to the counties. Shift this over to the school districts. The shift in provision actually led to a period of a certain amount of chaos, I think, for local education agencies, for county departments of mental health, and particularly for children and their families. Despite, and I think, very good efforts on the part of CDE to bring stakeholders together to analyze those changes and disseminate information, it was very, very, very difficult. Here's what we do know about this. Anecdotally, we know that services vary widely from LEA to LEA and from SELPA to SELPA, with some providing outstanding services to students, and with others leaving students and their parents frustrated and unable to access the mental health supports necessary for their children to be successful in school. Early in the implementation of AB 114, a group of organizations circulated a survey to parents of special education students. Over 500 families responded. The results, as described by the California Department of Education in 2012, found that 25 to 30% of the families reported being told that services, including residential services, would no longer be provided or continue due to a change in law or the funding. And additionally, 64% indicated that IEP teams had not addressed changes to their satisfaction. In the summary, CDE reiterated to LEAs that the student IEPs must continue without interruption, and that those entitled services must be delivered to the students. Would you like me to wrap up, sir?
Please conclude.
I thought I had that feeling.
Thank you.
These are the areas where we've got the greatest concern. We don't know what happened to the students formerly served under AB 3632, how many of them continue to receive services under 114. We don't have good data on how AB 114 funds are being spent, if some go unspent, what happens to the unused portions, and we know that LEAs are interested in accessing Medi-Cal funding for service provision, and we're concerned that some LEAs provide differential services depending on whether they can bill Medi-Cal for students-related services. We encourage you to authorize the audit.
Thank you very much. Would you like to have a few moments?
Thank
Brief
you.
comments,
My name
please.
is Teresa Malikzadeh, and I'm here on behalf of the California Association of Private Special Education Schools. And we represent students in the non-public school world. We're certified by the State Department of Education, and all of our schools serve students who have not been successful in the public school setting. We too, I will piggyback on what Carol said, that we we've seen some really great programs out there that districts are working on and bringing in their own mental health people, or also contracting with experts in the mental health field to provide good service for kids. I think part of the concerns and the struggles that I'm seeing and that our schools are seeing out in the community is that sometimes psychologists are being asked to perform a duty or provide a service for a student who's very involved in the mental health world, and they're not able to provide that service because of their expertise in the educational world of psychology. So we really support the audit as well. I think the other confusion for the districts is some of them just don't know what to do, how to get started. So there are immobile districts out there that are not serving the kids. And I have spoken with other legal organizations. The Legal Advocates for Children and Youth has done a survey, and they work with foster youth. They have definitely noticed a decline in the assessment process over the past 5 years. So we're very worried about our kids.
Thank you very much.
Move the proposal.
We have a motion on the floor to move the request. It's been properly moved in second. Members, is there any questions that the members have regarding this before I go to the public? Hearing and seeing none, we will ask the public to please line up on the left side. You have 2 minutes. Please state your name and then just watch me. Thank you very much. You may proceed.
Thank you. Can you hear? Yeah. All right. I'm Margaret Johnson with Disability Rights California, and as you all probably know, our organization provides legal and advocacy services to families with children that are students of special ed. And we've seen a couple of problems that I just want to highlight for you today. One problem that we've seen is that the local education agencies are tending to move students into more restrictive settings rather than trying to serve them in less restrictive settings, which was happening before under AB 3632. In addition, we have seen, I hesitate to call it this, but a reluctance on the part of local education agencies to actually provide educationally related mental health assessments to students who have significant behavioral challenges in school. And we attribute that delay to the change from AB 3632, which was an easier, even though it wasn't that easy all the time, but it was an easier process for the school districts to utilize than the current process, because in many districts it's not very clearly defined and harder to access. So those are just a couple of things that we've been seeing through our representation and contact with parents and students. So we really believe that the audit will help flesh out some of the issues and hopefully lead to some solutions for some of the problems that we've been seeing. So we support the audit. Thank you.
Thank you very much.
Mr. Chair and members, Isabel Garcia, on behalf of the California Teachers Association, we urge your strong support for this audit request. We thank the author for bringing it forward, and we think the audit will provide important data that will help legislators and stakeholders ensure that students receive the mental health services they may need. Thank you.
Thank you.
Good morning. My name is Kathy Hall. I represent the California State PTA. We have been wholly in favor of high-quality mental health care services in school, and we are in support of Senator Bell's request for an audit.
Thank you.
Good morning, Mr. Chair and members. Adrienne Schulten, representing the County Behavioral Health Directors Association. We represent the public behavioral health authorities in counties throughout the state. Our members support the audit. We believe there are actually some best practices and models to share. One consideration we just wanted to reiterate is to make sure we have a representative sample of SELPAs across small and large counties across different regions of the state. Again, we look forward to working as this moves forward. Thank you.
Thank you.
Mr. Chair, Mike Carroll with the Western Center on Law and Poverty. We work with legal service organizations all over the state of California, and we're particularly interested in, obviously, low-income clients who are in the CalWorks program, the children in that program. There's more than 1 million children in that program. And for many years now, we've been hearing stories about the inability of them to be able to get mental health services and ending up having to go to the county mental health program to get services which we believe they should be getting from the schools. We strongly support the audit and look forward to seeing the results.
Thank you.
Thank you. Rusty Seelix, Mental Health America of California and California Council of Community Mental Health Agencies in support. In the 1980s, California was 49th in the country in identifying children with serious emotional disturbances needing help. By 2010, we've moved up to 45th, but we're still at 1/4 of the national average, 1/10 of where the top 10 performing states are. Clearly something is wrong. We hear that as a result of this program, kids are falling through the cracks they used to get care. Something is working right in some places, working wrong in others. We've worked with the Department of Education. We think they did a great job in explaining the new rules and rolling it all out, but it's clearly working very differently in places throughout the state. Hopefully this audit can help both the Department of Health Care Services and the Department of Education come up with appropriate measurements so we can figure out where it is working and why, and where it is not working and why, and what we need to do about it so that all the kids will get the care they need. We support this audit. Thank you.
Thank you very much.
Mr. Chairman and members of the committee, Randall Hager representing the California Psychiatric Association. We associate our comments with those who have testified before us. Our members around the state who do treat pupils have noticed a fall off in both access to psychiatric services as well as access to the more intense kinds of services that sometimes pupils need. We think this interferes with the pupil getting the right service at the right time and the right amount, and we're very, very supportive of Senator Bell's initiative on this and this proposal, and we recommend it to you. Thank you.
Thank you.
Thank you, Mr. Chair and members. Christopher Castrillo on behalf of the California Academy of Child and Adolescent Psychiatry. I just want to thank Mr. Bell on his continuous work in this area and particularly in support of this audit request. Since the loss of AB 3632, we have noticed throughout the state that kids are not getting access to the school-based mental health services that really help provide the early interventions and the supports that not only help them in the short term, but help ensure their success over the long term. Just want to again thank Senator Bell, and we urge your support of this audit request. Thank you.
Thank you.
Thank you. Bill Tolstrup, SELPA Director, Director of Special Education for Elk Grove Unified School District, the largest district in Northern California. While we neither oppose nor approve of this audit, we do want to make sure the committee doesn't generalize and paint with too broad of a brush, that some of the audit requests we have seen a substantial increase, and we have documented and have a lot of data about the services that are being provided. Site-based access has gone from when we had AB 3632, we had 129 students receiving services. Currently, we have 577 students that are receiving services site-based. It helps improve our parent engagement as these students have access to those services in their home school. Does not require a trip to a local strip mall. We've also tracked progress in attendance, which is up 49% in these clients. We've seen their grades improve by 56% of them. 78% of these students are meeting their behavioral goals. Non-public schools, there's a concern about more restrictive placements. Our requirement of the laws look at least restrictive, and as a result we've seen a 47% decline in the number of students needing non-public school suspension. We've also seen a drop with this population in suspensions from schools of 54% and have had no expulsions. While we, again, we have 66% increase in parents and students accessing service, and we would encourage that you don't paint with too broad of a brush and generalize this to all districts.
Thank you.
Good morning. Laura Wasco with the SOAR Coalition, which consists of 5 SELPAs in Northern California: Solano, Napa, Yolo, Merced, and Sutter. We're in support of this audit. We'd like to recommend that the audit also look at 2 additional issues. We have submitted letters to the committee regarding this. Back when the state shifted 100% of the services to LEAs, they didn't shift all the funding sources to the LEAs. The state did not address how LEAs could have direct access to Medi-Cal reimbursement through the EPSDT program, and we would like to recommend that the audit also look at the interactions between the SELPAs and county mental health agencies to determine if requests were made to county mental health to seek access to EPSDT funds, and if so, were those accesses granted, and if so, were there any overhead charges to the LEAs for this? Secondly, we'd like to look at, have the audit committee look at the issue of the funding sources during 3632 and then those funding dollars that were shifted to LEAs to provide funding for this service. We're in strong support of this audit, as well as working with the committee, the auditor, and Senator Bell on this important issue. Thank you.
Thank you very much. Is there any more public testimony? Going once, twice. Public testimony is closed. Senator Bell, we have a motion on the floor. Would you like to say something in closing?
This is part of a bigger issue, certainly, that we're going to lead into, hopefully, over the next couple years, that deals with services to children in schools and mental health services. And we need to first refresh ourselves by doing this audit and then lead on to a full policy discussion and have a full discussion about it, how to improve the system for all kids in California. There's about 600,000, we think, that need various types of behavioral health services, and let's do our best to make the system work good for those kids. Thank you.
Thank you very much. We have a motion on the floor. Madam Secretary, would you please call the roll?
Assemblymember Gibson.
Aye.
Gibson, aye. Asajian. Asajian, aye. Baker. Baker, aye. Campos. Campos, aye. Jones. Nazarian. Nazarian, aye. Rendon. Rendon, aye. 6. Senator Roth. Senator Roth, aye. Bell. Bell, aye. Cannella. Cannella, aye. Fuller. Galgiani. Lara. Lara, aye. Lever. Lever, aye.
That motion is out. That has been approved. Thank you very much.
Thank you.
So, are you going to
No, we're going to lift a call on the other items that we put on call.
Okay, and we're going to do them in agenda orders.
And we're going to do them in agenda item order, starting with 2015-108, the Irvine City Council Subcommittee, Audit Subcommittee. Secretary, please call the roll. Shh. This is on Irvine.
Nazarian. Nazarian, aye. Rendon. Rendon, aye. Bell. Bell not voting. Cannella. Cannella, no. Fuller.
That item failed. We'll lift the call on item 2015-111, California High Speed Rail Authority Property Appraisal. Secretary, please call the roll. High Speed Rail.
Bell. Bell, no. Cannella. Fuller. Lara. Lara, no. Lever. Lever, no.
That item fails. We'll lift the call on item 2015-112, California School District. We already did that one. That's it. Yeah. We have one more? Inglewood.
Yeah. I'm sorry.
Yeah. Thank you very much. We want to lift the call on item 2015-101, California Superintendent of Public Instruction, Inglewood Unified School District. Please call the roll.
Bell. Bell, aye. Fuller. Galgiani. Lara. Lara, aye. Lever. Lever, aye.
Motion fail. Oh, sorry, passes.
What's that?
It's out.
It's out.
That item is out. It's been approved. I want to thank the committee. Thank you very much, everyone, for participating in this process. And this meeting will stand adjourned.
You adjourned it.